Yes, Kimberly, the government has been facing questions about whether it acted too slowly to tackle this crisis. So this is where we are today. You can see 596 deaths. Now, we often see a lag on the weekends. The numbers can be slightly lower, but this is the lowest number we have seen now for nearly 2 weeks. And if we look at how our figures compare to other countries, you can see we are following in that similar trajectory to countries like Italy and France. Now, the focus today has been on what Britain was doing much earlier in the outbreak, well before lockdown, at a time when it seemed the virus was mainly a Chinese problem. So let's take this same chart back to that first government COBRA meeting on the 24th of January. At this point, China had put Wuhan into lockdown. 18 people, you can see that line there representing the number of deaths in China. 18 people had died in the country. On the same day, Europe reported its first cases in France. The UK would see its first confirmed case a week later. Now, Italy locked down Lombardy on the 21st of February. A day later, we would see the first deaths there. But by now, the UK government had set out that plan to contain, delay, research and mitigate. It was nearly 2 weeks after that the first person died in the UK, and more than a fortnight after that we went into lockdown here. By then, there were 335 reported hospital deaths. And this is where we are now. More than 16,000 people have died in hospital. We've had time to prepare. We've seen the trajectory in other countries. But would locking down earlier have made a difference?
And there isn't a simple right answer that says, press this button and it will all go away. It's about managing the competing, the deaths, tragic deaths on one hand, with the interventions on the other. Had we gone into this state of lockdown mid-January, then quite possibly we would have had very, very few cases.
The government has always said its decisions will be guided by the science. But some of those very scientists are now warning that the threat of more waves of the virus in the coming months means it's too soon to say for sure whether the right decisions were made at the right time.